So throughout your like nursing career, can you like tell me about like, I guess, a moment that sticks out in your mind that was very like, I guess, memorable for you, whether it was, you know, good, bad, the ugly, whatever stuck out to you?
Yeah, absolutely. I can think of, let's say, two stories, the good and the bad, right? The good were, I was treating a patient who was Filipino, but didn't have any immediate family, here in New York. But as we got to just engaging, talking, um, sharing our stories, family stories, they said, you know what, you're my family here, taking care of me. And, that's how you can make a difference in someone's, stay in a hospital without even realizing it by just having that connection with them. I would say the bad, which I don't really think is bad, but more teachable learning moments, is that during my time and working in the hospital, there are a number of Filipinos that work in the hospital, and the work that they do, I found, often gets overlooked or unrecognized and sometimes underappreciated, because the assumption is that they will work hard no matter what. We can give them as many assignments because they will never complain, they won't say anything. And within, sometimes in our culture, that's who we are, right? We want to serve others, we want to do the right thing, we want to do what's best for our patient, and conversely, not make a big fuss, right? And that's what I've seen in my family, and that's what I've seen with specific generations of Filipinos who have immigrated here to the States. But I come from, I guess, a different breed, right? I am an American Filipino, and the way I was raised, or at least how I've grown up to be, is that um, I'm okay with being that disruptor and accepting the potential causes of doing that, in lieu of making sure that I shine a light on some of the indifferences or potential injustices that are happening as we see them. And it does happen in the workplace environment. So oftentimes I try to at least shine a light on how can we make some things a little more equitable in the workplace, that I've seen a lot of Filipinos get overworked or dismissed or passed up on an opportunity. And I think for me, one of the greatest things was seeing Dr. Dia at NYU, because in my line of education and researching and everything, it dawned on me that I didn't see many Filipinos at specific levels, right? I didn't see CNOs, I didn't see directors, I didn't see professors, as much as I would think they would be in those positions, knowing that there's a large Filipino community in nursing or in healthcare in general.